Hey, how's it going? I'm Dr. Russell Teams, and one of the reasons you're watching this video is Trish has probably referred you over to me, and that's awesome. We've worked with a lot of the same patients over the years. We refer back and forth for various reasons, but one of the main reasons she refers people over to me is for issues with like anxiety, depression, dysautonomia, or things like POTS. The symptoms of that can often lead to high heart rate, blood pressure, sweating changes, inability to tolerate like heat or light or sound, or just you're really easily triggered. And so one of the reasons I'm making this video is so that you can feel a little more comfortable following that referral. And one of the main things we do here to help people with those conditions is, number one, we strengthen the brain. So we look at the front, back, sides, and the vestibular system and cerebellum to really try to strengthen that system so that you can function better in your day, or that you can tolerate your life or the world that much better, right? The way that I talk about things like stress and tolerance is stress usually happens like this. There's different variations or different levels of that stress. And where our tolerance is determines if we're symptomatic or not. So if our tolerance is here above the level of stressors, we're going to be fine. It's when our tolerance decreases and anything above that becomes symptomatic. And so what that typically is a result of is things like head injuries, traumas, emotional traumas. Somebody could have problems stemming from when they were a child, whether it was a physical injury or an emotional injury. We could be dealing with infection or things like COVID or long hauler syndromes or anything like that that can decrease that tolerance. A lot of times it's just basic stressors overloading the system over and over and over and over again, and it just keeps dropping to where life just gets really, really difficult. So if this has resonated with you, hopefully this just helps to understand, or helps you to understand, that it's a really potentially good referral, but we really figure that all out in that first visit where we do all of our evaluation. And I look forward to meeting you.